Well, I spent 9 years in Chiapas doing the work of Partners in Health, and we'll talk about this a little bit later on. Thank you. Hi, good afternoon. My name is Lindsay Palazuelos, and I started in getting to know the jungle in 2008 with Danielle, and we founded Partners in Health in 2011. And now I work as a director of policies in governmental joining in Partners in Health. Well, now we can start with your screen. If you can please help us with the screen sharing, that'll be awesome. Well, hi, good evening, good afternoon, friends, colleagues. It's a real pleasure to talk to you a little bit about how can we make a reality Partners in Health. Maybe you have questions because why Chiapas, why the Highlands, why the style of work? Next up, please. Well, on one hand, we can say that everything started with a disaster. The Hurricane Stein got to Chiapas in October 2005 with an amount of rain that was immense. Rivers grew and people was affected because of the house stock and lives were impacted by this. Chiapas went through an effort and through an autonomous NGO working with the Guatemalan refugees after the Civil War. After they kept on supporting and after the Zapatist rise in 1988 when Dr. Al Farmer, visited Chiapas and wrote this chapter that's nowadays found in the Pathologies of Power. The majority of this work was based in San Cristobal, but when I got here, there's a group affiliated with Partners in Health got me to the Chiapas Highland so we can help people affected by Hurricane Stan. And we can say that in this picture, we have the first clinic of Partners in Health, a whole dispensary of the church in Belisario Dominguez. We have 3 rooms. We had 3 rooms. One for the houses that got to us through donations in thanks to U.S. churches. Another room to look and to basically observe patients, and another room for patients for a family that lost their house and sadly half of their family sadly. But I also learned a lot from that experience. But these are lessons for a different day. But mainly, I learned that we needed to do a lot of work in Chiapas, so I wanted to stay there because of this. And to take this and do this work, we needed to be realistic. To start with, as Mike Twain said, there's no new ideas, but rather old ideas that you put in your own mental kaleidoscope. Uh, our friends here, they can you can look at the pictures. Lionel and Talma helped me in the first years understanding the importance of how were they living closer to people. In this picture here, we see that we have a visit in Boston for a Partners in Health conference, and the famous actor Danny Glover wanted to get a picture with them. The funny thing is that after we got this picture out, they asked me, "Who's that guy over there that just asked us for the?" So the work in the jungle and the highlands back then was to teach and to work with Partners in Health. You can see the huge crowd of the mother highland all gathered there. The good thing is that it was a really comfortable and joyful activity, even though that it was filled with uncertainty, danger sometimes even. You can see that in Honduras here, we had underneath the Catholic Church a campment the damnified people from New Argentina. And back then it costed us to walk 4 hours more or less from Siltepec to Honduras, going across rivers, and most of times led us to these places. And reflecting on this, I realized that actually we do things because of complex reasons. Myself, with my double nationality, born in Mexico but grown up in the U.S., had this opportunity in Chiapas to go back to Mexico and supporting my country, my origin country, and being closer to my family. At the same time, I was putting together my own family here with my best friend, the smartest colleague that I found in my professional life, Mrs. Lindsay Brockman Palazuelos. And from the beginning, we tried to make this work grow as a health system and also as a school for social medicine in practice. That's why a huge part of that work was to receiving students and residents. Out of this, we have many other stories that are nice, but my favorite one is down here. If you can take a look, Rodrigo Cepeda, the first intern, teaching the goose how to swim in the river. That was a goose that followed him as he was her dad because he nurtured her since he found her as a baby. So many, many nice stories. And the work also was to say that it wasn't just in Mexico. We had a whole different effort in Guatemala that's ongoing, even though it's smaller. And here, for those that know, Chico, the health promoter, his father's dead, and Chico came here to visit and to work with us. Next one is, and there's many stories during these first years. For example, in another occasion, we launched an effort with different NGOs to give treatment to the first patients treated for tuberculosis and resistant tuberculosis in Chiapas. Mr. Don Benjamin followed, sitting down here outside his house. Thank God he survived after many years trying to get an efficient treatment. It was thanks to this experience that a doctor of the Pajo told me that she was going to send me to jail if I didn't follow her rules, but that's a story for another day. We also experienced back then with digital programs that were innovative. We published articles on how health promoters received it. That was a technology that was old. The type of a chocolate bar telephones, not the ones that we have today. And another story for this is that we explore the way of doing decent epidemiology and based in the people's knowledge. But more than anything, we lived with people in a real close manner. We lived in their houses, sometimes in the camp, real or nearby the houses, actually next to the dog and donkeys. My promoter, Lionel from Tante Isabel, and his son go walking to treat a patient with tuberculosis. This kid had so much effort and he surpassed us many times just going up the hill, just playing around, singing, and just playing around while we were almost dying of exhaustion. These were really this type of experiences that helped us to fall in love with people. And also, we fell in love with the highlands. It's still a jewel in a planet where climate change and many other challenges put in risk places such as this. And as Daniel mentioned, we also support community promoters of health based in a network of small uh, towns in the mother highland. And usually we would stay at their household where we would be fed really generously, and they would give us space to live and to sleep and just getting along the way of life. I started learning about everyday rhythms and the rhythms of coffee crops and harvest, and I love to feel the breeze in the mornings and sharing a pot coffee next to the fire with his family, a family that you would usually send the daughter or son to help me to find the way to one of the members of the community. And I love to have a conversation with them while they were showing me the surroundings. They will tell me about their favorite gossip, and they will ask me about life and how it was from where I'm from. Usually, we would have long conversations after dinner during nighttime, and we would hear stories about family members that went up north in search for work, poor crops, and formation of cooperatives of coffee from the previous era when there was no land, no schools. We also heard many, many stories looking for the relief of that suffering, meaning looking for medical attention. People knew that when there were diseases, they could only hope for obstacles. Local clinics usually were closed due to lack of staff, or when they were open, they had lack of supplies. What left this treatment in a halt and diagnose and saw type of treatments. It was an expensive type of experience. We heard a lot about the medical visits at home, and I remember as a kid that was able to look at the community from the window of his house. He lived with epilepsy his whole life, and he was experiencing a high deterioration. The local nurse had asked for medication that never arrived. His family was looking for attention, and sometimes they received 1 or 2 months of treatment, but they weren't able to obtain continuous treatment that was necessary to face these conditions. And each visit to an specialist was impoverishing them. Also, we were able to get to know a young fella married with kids, and he lived in a town at the end of a road with scared of a mountain, and he had received treatment for tuberculosis, but he still had persistent symptoms, and that they was worsening. He was looking for attention in all of the places that he could get it from with his scarce resources. We suspected that he was suffering from resistant tuberculosis to medication. And one serious disease, but with a good possibility of getting cured if you were able to get the proper treatment, of course. But our efforts to help him to receive treatment were short, and finally he passed away, sadly. This experience, in many ways, pushed us to create incest. And well, we can say also that during that time, back then, we were a small type of work with a budget of almost only $10,000 per year. But everything changed after a day with the captain. We found a group of donors from the US visiting and looking for projects to support. In the following 2 years, they will donate enough money to launch what we call Partners in Health. And like we said, lucky favors the prepared, or in this case, 99% of our success was to arrive. And with that money, we hired Hugo for the first time. With this group of Lindsay and Hugo, we had the three musketeers basically, all for one and one for all. And I know that I always going to remember what we did during these years with a lot of pride. There's nothing better than making something newborn with your best friends that wasn't in existence before, but now it's alive and strong. Sometimes we uh, always joke around the fact that Seth was our first kid. Well, I got to Chiapas to work with Lindsay and Daniel just by at the end of my medicine school years. Can you hear me? Yes, you can. Okay. Okay, as I was saying, there's a technical problem, but one of the first things that I did with arriving to Chiapas when I got here with Lindsay and Daniel, I heard it before from Partners in Health, but I was really curious. I read the pathology book of Power of Paul Farmer, and I think that we concentrated Partners in Health philosophy right there, and it resonated a lot in me. The idea of this is inherently immoral. The access of health services to be established by the acquisition power of patient. It's something that I was going around many times at the medicine school. I remember that I was really conflicted about looking at the differences in treatment that were given to patients at private hospitals regarding or comparison to public hospitals, from mistreatment from the staff and structural factors like the fact that as students there were procedures that were only able to conduct with public patients and not private patients. A lot of times with unsupervised attention, we found that the access to health is a really political matter and social as well, and it has to do with the value that a society allocates to each citizen, and it has to do with the amount of resources that are willing we're willing to invest to make something alive in countries such as ours, in regions such as ours in Latin America, and in places such as in states such as ours, like Chiapas. See people suffer from treatable diseases at all times. We don't see the level of uh, indignation that we should see. This is really well normalized, and that's why we don't see robust response to this problem. I would even dare to say that probably we have not considered this as a problem. So, like my colleague said, we had to see this firsthand, and back then we didn't have the resources to do something, but we were at the task of looking for them, and we said that this was not acceptable, definitely, and we had to bring real medical attention to this region of this Chiapas city, where services have probably and historically have been really limited. And what we've learned from people of the Highlands was fundamental for the way that we've structured the first efforts of the DSS, where people were finding a fragmented health system. We tried to open continuous access and trustworthy to attention in their own communities. We recruited and supported more staff to keep our doors open from these clinics, and we strengthened the supply of equipment and medication, even for chronic disease such as epilepsy, where people needed screenings and timely screening. We created a system for the active, regular search of cases door by door, where the specialists in the capital were so inaccessible that they could have been in the moon. We provided a material support and joining through the right of health program, and where suppliers regularly were taught to blame and preach people needed a compassionate type of treatment. We created a training program and mentorship based in not just in clinical concepts but also in social medicine. And this focus of learning and working alongside of the people of the Highlands have given us a lot of fruits in mental health, reproductive health, and so on. So from then, many people started to add up to the SS project. Many of them and many of the interns, without having a real project, actually believing in the idea most of anything. We had the fortune that throughout the years of having joining of dozens of the professionals of health that have added up to this cause, we added that we've fallen short and we weren't able to help everyone that needs help. But this parenting health spirit is to pour ourselves into this task in carrying the message that no death due to a treatable cause is acceptable. And on the contrary, each one of these deaths reflects a dark side of our humanity and of our society that we should face. That's why, under the principles of preferential option for pause, joining, proximity, recognition of the rest among ourselves or within ourselves, we continue fighting for an equitative type of society. We need to stop normalizing the fact that some people need better clinical or medical treatment than others. We need to stop this whenever or whatever we find it, being in academic spaces or public policies or practice of services themselves. I would like to finish my part with a phrase of a founder, Paul Farmer. We hope you can join us during this path, and not just in health matters, but also in living together. His idea that some lives are worth more than others is the root of everything that's wrong in the world. And there's many things that you could say about today's session because actually has exceeded our dreams. But what gives me a lot of joy is that this model now combines with doctors and nurses and working with students and professionals in an integrated manner. All everything based in a close relationship and humble relationship with society. The same style is ongoing since the first days. and you can find it in any program of PNH, Haiti, Sierra Leone, Malawi, etc. And also, it's important to thank to those that supported us. There's a joke that says that uh, this is a program that started outside of the head of Post Farmer, but we owe a lot to his mentorship and support. And I remember that during a visit in 2016, he supported us when the organization was in a poor point because of political problems with his ability of being able to connect immediately with anybody, including people from the highlands and the governor itself. He was a perfect individual for this critical time. At the same time, of course, we can tell you how it's an important story. He rather driving because he feels dizzy and he almost kills us a lot of times. But then again, that's a story for another day. And we would like to thank Howard Hyatt for his support during these first years, and always to Georgia Morgatti, Dr. Georgia Morgatti. More than anybody, he was supporting the Chiapas work since the 90s. Actually, we consider her one co-founder as well. Maybe she would say that that's not her best picture from Haiti in a boot camp trip, but I love this picture because you can see here in Joya's face what she does naturally. She hears people, she plans, and she does what's necessary to be able to move and put forward this real work in justice in social medicine. Thank you very much, Joya, for everything, and thank to all of you for listening up to this brief story. And especially thank you very much to all of you, which are the ones that created sets during these 10 years. Thank you for that. Thank you very much again, and I have the honor of being able to ask you some questions to our founders, and I would like to start with Daniel Palazuelos. Daniel, what are your memories from the first clinics that SETS supported? Well, like Lindsay said, we used to have like a lot of efforts in the Highlands trying to improve medical attention, and we realized that actually what people wanted was a functional clinic. So we started with Macasanos and we entered the clinic, and really it was only like a sort of rotten box with mold and this scratched and kind of ugly. But people started getting there, getting there in big amounts because we had three fundamental things going on. First, materials. Second of all, we have staff, people that was nice, people that was there to really respond and service people, and also systems. Systems to probably make references or to not of or between people or to say people, I'm sorry, you cannot do that here. But like Hugo said, rather the philosophy of Partners in Health overall, it's to try and never say I can't. We acknowledge your humanity, we acknowledge that you deserve access to that same treatment as somebody that could be in Europe and Boston. Equity in the medical results, and that's something fundamental in the way that we work. And even though the ugly clinic in the outside had a lot of good things on the inside, and now it's really well painted. Don't worry about it. Thank you very much, Daniel. Now I would love to ask Hugo, what was that time where you thought, yeah, this is going to work? Well, really, things were given themselves. There was a series of events, actually. It was kind of a luck, I might say. Georgia was the one that launched us to this. I had the opportunity, and that's thanks to Lindsay to go to Boston in October of 2010. And I was talking to Joya, but only of thinking that there was a potential in Mexico, but thinking that we had an organization of partners in health that didn't exist in the country. And she said, okay, that's fine, let's do it. It was really spontaneous. I wasn't waiting for that. And then I said, okay, well, the step one is there. We had already spoken with people from the jurisdiction, with Dr. Merida, that if it is there, many, many things. And we owe a lot to him. And if not, well, he can probably watch the video if he's not here. And we can here at the clinics and back then. And we're talking about of Matasanos, Honduras, where if we could receive interns here for medicine, they will give us opportunity to work instead of being in campaign tents. And they say, yeah, if you get interns where you have your doors open during the first 2 years, and that helped us a lot. And financing as well. These people from Green Mountain Coffee, that it doesn't exist now as such, we just talked to them about this idea, and they said that's the money right there for you guys. So all the stars were aligning. The first interns were Abelardo and Alejandra. Abelardo was my friend from medicine school, and we invited them, and we said we'll leave. Jaffer Arrieta is also there, so a big hug. He's my colleague, my partner from medicine school, and we saw each other fortuitously. And I was traveling, she was living in Spain, and we had a friend in common. And I said, Jaffe, she was looking to go to Mexico. So I'm like, if you have the opportunity, maybe you would like to come to work with us. And she said, yes. So the first 2 years, she gave us a lot. She supported us a lot. So I believe that it was really weird, actually, because basically everything was coming out good. It was a situation really, really hard for us. We didn't have anything, but everything was going out good. And the stars were aligning with themselves, and we needed to get out of here. We say we need to do this. Thank you very much, Lindsay. What do you think now that when you see what SES is doing, how much it's grown? Well, I feel I'm really proud. I feel that I think you should also feel really proud about yourselves because each and one of the people that has been added to the team is contributing to something important, and it's excellent to see how organization evolves little by little, even with the same principles and with the same spirit of solidarity. We still have these programs going further than we thought that they were going to go originally. And then this focus that we had of multidisciplinary work between the different health professionals is something that also gets me really happy. So looking at from us 4 or 6, we were able to get a whole organization with hundreds of people involved that serving thousands of people during the year, that's innovating and that's training professionals of health, not just clinically speaking, but also with a social medicine focus. That makes me feel really, really happy. And of course, let me sort of send you a hug and a lot of appreciation for all of the work that you are still doing every day. Thank you very much to the founders for sharing and establishing the origins of Partners in Health. These values of solidarity, social justice, and joining are those that All organizations share for partisan health, distributed in 11 different countries. All of the work that was achieved during these 10 years has been possible due to the participation and collaboration of many allies. I would like to open the mic now to Paula Martinez, leader of social impact of Johnson & Johnson Mexico. Hi, thank you very much for including me in this such a beautiful space, intimate space, special, and celebratory of 10 years. For us, really, it fills us with pride being able to be a part of this incredible work that Partisan Health has implemented in Mexico, and just the messages of social justice, the values of social justice, joining, solidarity, especially the right to health. This was something that actually inspired us to be able to be a part of this program. It was in 2016. I was coming into Johnson and Johnson, and my task was to found a social strategy for Johnson and Johnson Mexico, the companies of Johnson Medical and Consumption that are here in Mexico. And well, it's incredible. It was incredible for me to say, of course, that a social responsibility program needs to be focused in the right to health. And alongside with Partners in Health in 2016, we started this collaboration that, well, until now, we've been enriching year after year. We were able to give place to this extraordinary collaboration between the Dignified Treatment with Public Health and Dr. Meneses, and where we were able to work also strongly and closely just because of the fact on how do we connect with these challenges of attention to health. And as you know, when we've mentioned it before, our leader of consumption, Leonardo Curado, was at the beginning of this Congress. He was telling us how Johnson and Johnson, since its foundation, thinks that foundation to have a healthy lives is in communities and in health staff. And that's why the global strategy of Johnson and Johnson is focusing to strengthening uh, the focus on social impact, midwives, nurses, and community agents. For this way, these communities are able to have this access to health and this access of quality of health, given that these actors are sometimes the only links with communities to be able to access health services and receive enough information that allows them to take care of their health. In Mexico, as you've seen throughout the Congress, attention in health is unequal in terms of quality and amounts of available services. And we have then this huge challenge globally speaking. We are talking about that over half of the population doesn't have access to decent and essential access to health. And we're talking about that we are almost 400 people that lack this. Also, we have another data that recall. This sounds a lot in me. There's a deficit of 17 million health workers, and the 9 million of them are midwives and nurses, and 2 million social workers gives us a really scarce landscape of worldwide health. We can say it's not fair because they're specialists and they need to respond with quality and essential services to the vulnerable population in different parts of the world. So the investment in primary health is really, really necessary, and that's how ourselves as a company we attach and added to focus into a strategy that's looking for a triple impact. First of focusing in improving health, creating more work, of course, with community when developing these abilities with health workers, and of course closing gender gaps. So this way we believe that we can add ourselves, making alliances with the government, civil society, academia, and different actors in the different places of the world where the company operates to be able to close gaps and strengthen primary health systems that are solid and based in the community as well. So that's it. I'm more than happy to be able to be here sharing this space with you and to be able to have the honor of being in this final part of the Congress because I see it as a real positive achievement of the whole Partners in Health team. So I celebrate with you with a glass of water, like Vale was saying. We'll get to the point of having the nice cocktails, but thank you very much and congratulations, everyone. Thank you very much, Paula. We have a commitment to achieve, and that's for all of us to have access to health quality and the strong alliances and commitments of so many have allowed us to come forward with this. We would like to take advantage of this space to share with you the challenges that we were able to obtain together during these 10 years and to thank everyone that made this possible. Thank you very much again, Paulo Martinez, for all the support that you're providing us to Johnson and Johnson. The collaboration of work with decent, dignifying treatment, which is a part, an event or initiative with Partners in Health, and it's taken us a lot of months, and you can say, wow, it's already finishing, getting, and you cannot believe it almost. I would like to introduce some slides. If you can help me, please, to set in the slides. These slides are going to help us to share the achievements that we've been obtaining during the years. There's many, many challenges, achievements, and we had to select those that we believe were the most impactful in the organization. And of course, we would like to take advantage of this space to thank each and one of the people that made this possible. Everyone, all the foundations that have supported us. Has been 10 years, and many people have, behind this. We try to have everyone here, but of course, if your name is not here, you know that we have you in our heart, and we are still really, really thankful for being a part of the Seth family. So I wanted to share with you. It's a real pleasure to be here with you and with the team of work. Since I started this journey with the organization in 2012, they told me that once you come into the sales family, I would always be a part of the sales family, and they were in line. Today, 9 years after this, the sales family is not doesn't stop growing. It's still my daily example of commitment, with a strong commitment of fighting to make this world a fairer one. And since I learned to provide medical attention from a social perspective, I had to question my training and its roots. Everything that I thought was all right, and I saw as normal as my clinical practices in hospitals and schools. But I understood how far we were, not just at the local level, but also nationally speaking and globally speaking, of being able to have a right of health. From the get go, what impacted me the most was the strong commitment of my leaders and colleagues. And even though I didn't have clear yet what my next steps were going to be, what I was pretty sure about is that finally my practice as a doctor had sense. When we got here, we were a group of 6 people providing a service in 6 health centers. The first focus was primary attention with chronic disease such as diabetes, hypertension as priorities. Immediately in 2012, we started the joining program, understanding that the most valuable is knowledge of people in the community. During this year, we have observed the huge need of being able to refer people to hospitals of second and third level, and the big need of mental health, opening corresponding programs in 2013, 2014. With years, CESA has continued growing and expanding in a series of health centers and programs. For 2016, we started a maternal uh, shelter to help the birth of people of women in a dignified and decent environment. In 2018, we started planning out the collaboration with the basic community therapy program with the surgery program. And last year, thanks and due to the pandemic, more than anything, we that we didn't wait for, we didn't hope. We had to grow as a team and we had to accelerate certain processes to be able to face this pandemic and to be able to provide attention in the mother highlands of Chiapas. I would like to open the mic now to our colleague Marta Rieta. Thank you very much, Val. It's a real pride to be here. It's difficult to summarize these years of attention, commitment, and of fighting for health as a human right. In this graphic, we can see how we walked with over 10,000 appointments to to the amount of appointments that we have now annually, and we see that behind the numbers there's a lot of stories, and the patients that have been attended by our staff, they were able to obtain this right of health in the household of the motherhood in the main hospital, and we feel really happy of this model that's looking for better results for patients through innovations in attention and professional attention and generating leaders in social change. And talking about leaders of social change, we love or we would love to have a conversation about our internship program. And I think that nobody summarizes it better than Kurt Figueroa, our graduated, that says I can establish and find his life before and after doing this program with Partners in Health to attention model based in an internship allows us to be key actors in this type of professional life, to look for them to have mentorship and education that impacts the way that they deal with patients and they establish a profession inside. And as I said, we look for our interns to look what they've learned to many other professional scopes such as medical specialties or specialties in nursing, the exercise in public health, implementation of programs. It makes us feel really proud of what we started with only in medicine interns, and now we have obstetrics, OBGYN interns, and community help that would help us to put together and train these nurses and specialists in health. We were able to strengthen the interdisciplinary teams of health from 83 graduates, 26 are still active in fields such as SES and global health. And well, we're really proud, of course, of having them outside, out there in the world. We would like to tell you about the story of Cecilia Galvez that started as a volunteer in one of the CES clinics while she was completing her licensing in nursing. And she's an example of resilience, of leadership, and of deep commitment with the community and its patients. Afterwards, it was our first intern of community medicine, and now I'm proud of saying that she is a part of the primary care team, primary attention, fundamental part in clinical supervision and infirmary, and she is a mentor and a guide for all the staff that's developing a task in our community team. Ceci is a huge example of health professionals that we hope to graduate off of our internship programs, and what better that with her words to hear what this or what that represents, or this hope that represents. These efforts would be impossible without all these allies that have joined us during this process, and we would like to thank especially to Decent Health, Postal Scientific, Baxter, the Mastic Foundation, Gentera, Vitamin Angels, Regina Marcos, Alicech, to Doctors Leticia Montoya Aliaga, Dr. Merida, which are really important allies within the Secretariat in the sanitary districts 10 and 4, which staff is really important for the functioning of the clinic that support us. Thank you very much, everyone, and I feel prouder than ever of being a part of this. Thank you. Hi, good afternoon. Well, also in behalf of the joining or monitoring program, which I coordinated many years ago, I would like to highlight some achievements that we were able to have throughout this whole time. Actually, this program is one of the oldest programs of CES, and it actually started with the goal of strengthening follow-up of chronic patients and being able of achieving a good adherence and consultations and this type of activities, and we have been able to achieve this with the pass of time. So much so that we saw the effectivity with chronic patients, and we started doing the follow up with maternal patients, and we're contemplating now a different model that covers a whole community. And just to highlight some of the numbers about this program, just as we were able to cover different patients, as we can see in the slide, approximately 588 chronic patients, 630 patients of mother motherly care, and through the years, helping them through sessions of early stimulation, we were able to work with a huge number of women from the communities too. And with that, we've seen and we've identified a huge achievement of the program, contemplated more as a social impact of social change with the networks of people joining. In that sense, we've worked with 138 women that we've trained and we were able to make them a part of the team. We've had certain changes and different needs that we've been covering with this new staff. But now we have 78 people joining that, in a way, professionalizing 26 of them, and we're really happy about it. Also, we've had community workers that were able to ascend in the organization. Nine of them are now in community specialized type of work, such as the caregivers of mental health. And we had six people in this situation. And we've also had the luck and the huge advantage of carrying out supervision of um, these people that are joining with us, and they are located in different positions. So we have achieved different capacities, and all of this has impacted quite a lot in their lives and also in the lives of patients. I don't know if we can change to the next slide, please. Thank you. Also, it's much so that we have some testimonies here, like this uh, colleague of us that is poured into the IPC's work, and they've noticed a difference that when she started her work and currently what she's doing, where we thought that the role of a woman was more in the household, but now we accepted more within the community for them to be out, to conduct visits, and to have the responsibility with the clinic, and that also allows them to undertake this task in getting some money to their households. Also, different types of people joining. If we can change the slide, everything that she loves about her work is also mentioned here, and everything that she can learn is applied, and she communicates it with many different people of the community, and that has helped them to build a network of support among all the people that she helps and she covers. So these are small changes and reflections on what generated through community work, which is constant and really close to what we develop. And so for us, it's a pleasure to see all these changes, and we continue working towards them. And we would like to thank, through our program, I don't know if we can change slides. We would like to thank Abby, has been our donor for 5 years already, and always been really aware of the support that we are provided, and to Notre Dame University as well, because we were able to have a good collaboration with them. We have voluntaries that have come from their university, and they have provided a lot to our program. And at some point, we have received the support of Dr. Matias Iberico, poured out during these last 2 years to this program, to Joan Kegel, Steve Reifenberg, to Luisa Estrella Massa, that also supported us with early childhood matters, Whippy Island volunteers, and Carolina Noya. Thank you very much to all of you. Hi, I'll share a little bit about the program to Right of Health, which is the one that I coordinate currently. I'm Dr. Alejandro. And about Right of Health, I can say that we've been trying to obtain the right of this type of specialized services since 2013 that the program started. Currently, we support over 540 patients. And in the story The program we supported more than 1,200 patients. The numbers are still growing in the 11 communities. And it's important to mention that we've had the opportunity of collaborating with researchers running at Tenas, thank you very much, that have shown that the program increases the likability of references to be approved, that patients attend to appointments and providing follow-up to all of these rejected references to be able to have this right of health and obtaining specialized services. Next one, please. And of course, we want to see that the patients also have 14 point years of life adjusted by quality of life due to the interventions of the program. And this only reflects thousands of histories like this in the program, some of them in photographies and the screen that we are really um, proud of sharing with them and with you. They're not just patients, but their families and communities. Next one, please. I would like to thank also infinitely to the over six patients or six hospitals, I'm sorry, in Chiapas and Mexico City, which we had the opportunity of working with. In each and one of them, we have many, many people that are really valuable and that are always alongside us, helping us with the support, with the collaboration, social workers team, infirmary, nursing, surveillance. All of them are really special for us in all the hospitals that we collaborate with. I appreciate the distant support of many specialists, medics, and doctors and allies that help us, residents, ex-interns and volunteers, and everyone that show the interest in solidarity for and with the patients. I think Johnson Johnson at due time was also part of the donors of the program. And I would like to thank especially to Dr. Nathaniel Enriquez and Dr. Jose Manuel Perez Tirado for the great collaboration and participation with the program. And of course, I would like to thank infinitely to Miriam, Lupita, Bernardo, Daniela. Guys, thank you very much for your for your fight, for your daily fight for health to be a human right. Thank you very much for that. And well, in regards to the mental health program, since 2014, we've seen the load and the suffering that mental health represent, and we have the pride of being able to say that thanks to the team, we released a lot of patients of this change. And when we got there, we found about six people chained, not being able to access the service. Thanks to the community mental workers, we attended over 1,000 patients in 2009. They received treatment to treat the depression, anxiety, violence, psychotherapy of low intensity that's called trying out with problems too. And it has a huge impact in the level of savings of time that patients have when deploying to a special location for specialized service. Over 4,500 hours saved, for example, over 5 hours per user to receive the attention where they don't have to do it because they have access in their own communities where services arrive to them directly. Financial cost over 250,000 pesos not spent by users, or over 2,000 per user. What for 4 or 5 consultations that they used to have for psychology, now they can save that money and they can access to this rights on site. At the same time, the housing, transportation costs for 5 consultations, which are the equivalent to this therapy, are also and have shown a huge impact. In the next one, also we can see it when we impact our mental health cares when they talk about their patients. Like this note that we have from Juana Roblero, and you can read it if you like, where she refers quite a lot about the impact that it had in one of the patients after joining her doing some gardening and showing her how to manage internal resources and how satisfied she was of being able to help these patients too. And we are really proud of being able to publish her and another carer give her the right of health for us, it's really important to raise these voices. And we would like to thank in the next one to all of this, the donors and also organizations that we've collaborated with. You can see here, without you, we wouldn't made this possible. And personally, in the next one, to all these people that are the minimum that have contributed with their time, with their work, to mental caregivers, nine that I hope they're here, and of course to all of the organization that made and it's a part of this success. Thank you very much. Good afternoon. My name is Helen, and I'll talk to you about the sexual and reproductive health program that I coordinate in collaboration with Dr. Mariana. The achievements of the sexual and reproductive program, among them we have that so far we have had 38 interns that have learned during a year the respectful birth method, and we have 11 to be graduated that are undergoing their social services right now. Every year, Partners in Health is providing over 2,000 appointments, and we are helping over 650 pregnant patients in the first level of attention. We support also women that have high risk pregnancies so they can access the services they need during our whole task and trajectory. Thankfully, we didn't have any death. And we are working since 2016. In 2016, we only had nine vertical births in our main household, and we are responding to over 67 in 2021. Our percentages, we measure how much are we working, and some indicators such as uh, birth control after abortion, after birth. And we see that in 2016 we only had 24%, and nowadays we are at a 50.8% of this. We are helping out over 33.5 births per month, and we have over 136 OBGYN appointments. We provide also annually more than 1,000 birth control methods, and these are turned and given to adolescent population. We have reinforced even more our family planning sessions, and we have an offer of 12 different birth control methods that allows us to have more opportunities to access this service. We also have good practices we were sharing in trying to look over like episiotomies that are harmful for patients that have been reduced now to 8.7% nowadays. Also, we've seen a huge increase of the free position of birth. Nowadays, 76.7% of our patients can choose a position that they want to have their birth on. Like we've seen that if we reinforce the management, active management of the third space of care or the third level of care, that it allows us to give more comfort to patients in this process. Or during this process, we've seen that we were able to include more for families and include more support for families, given that 80% of our patients nowadays that go to a birth can be next to the person that they decide to. Nowadays, we collaborate with people dedicated to traditional uh, birth from the different communities that we work in different ways. Currently, our staff, our birth staff, or OBGYN staff can establish their own autonomous low risk treatment. We work with an infirmary team, general doctors, and specialists, and even more virtually speaking, and even more providers know these type of model, and each time this type of models are used with a lot more trust and confidence that we are now close to inaugurate a second one. And we're proud for Partners in Health to provide a space of safe um, space to work, basically for all diverse staff. And one of our colleagues is actually OBGYN nurse, and she's really thankful to all of the women that do it, and through her deliveries have helped her with understanding how life is and how beautiful this situations are. And we have a quote here, and people say that the attention that you get there is better than in other places, and if they could change something, that would be for them to have more nurses such as the ones that have helped them in this place. So this piece of work, we haven't done it by ourselves. We want to thank everyone that is on the screen right now that have provided us and given us their help, resources, training, that have given us all of their trust, and beyond, uh, wonderful people from the municipalities, El Albino Corso, former mm, coordinator Dr. Martin Melendez, Dr. Javier Tomasines, Dr. Molina, that are giving us their openness to start this project. Next one, please. We would also like to thank Andrea Reyes, Rosmolina, Fabiola Articia, Carlina Menchuda have been the foundations of these projects that currently are not with us in this project, but they've made an awesome work. Carlina Cervantes, Claudia Saldivar, all of the interns of nursing, medicine, delivery, OBGYN that have joined the project, on Luz that have helped us, to all of the volunteers, and to all of the team that's joining us today as well. Thank you very much. Good afternoon from the Research of Impact program, and we would like to, yeah, all the predecessors of Partners in Health. We've developed around 57 interventions in international seminars in the last 3 years, around 40 publishings in magazines from the creation of the organization. And since the training program, we were able to make possible to have 112 students completing their years of social services in the organization. Also, we made possible this Congress. So we have with us a great network of people and organizations that made this work possible in these last years. Thank you very much. Thanks to all the volunteers that have made this possible. We've already knew about this, but we just wanted to share that the pandemic year that we had to face, due to security reasons, many of the volunteers that were with us had to leave, and it was almost half of our working team. So really, the volunteers team has been impressive. Thank you very much for giving us your time. And really especially, we would like to mention that at the beginning, Martha mentioned something about nursing internship, and our first intern of infirmary social services is Maria Legorreta, and we want to really dedicate this event. And she was our first intern in nursing, and we will all heard our focus in nursing, the way that have been guided so far. So we want to have her really present here and acknowledge and recognize that thanks to her, in all of the efforts of nursing have been launched, encouraged, and we look to have an infirmary program, and we made it possible finally this year. And we wanted to also thank all of our donors continuously donating. Thanks to all those that donate in our webpage and all those that are subscribe to our monthly donations. Your help is really valuable, and we would like to thank especially to all of the population, all of the authorities that have opened their hearts, their house doors, and made it possible that we are a part of their house in Madrid, Chiapas. So also, we would like to thank especially because we have 10 years as an organization to Mariana, Juliana Montaño Sosa, and Fatima Gabriela, with over 10 years working with us. We have Ruby, Jimena Maza, Miriam Morales Camas, Edgar Lopez, that are also vital for our work, working with them over 10 years or 7 years in the organization. So, of course, to our MC in today's event, Maria Eugenia Reyes Lopez, that has been with us over 8 years, and special thank, really, really special thank to Mrs. Sandra, has been the mother of all of us that go through status, and is the one that has more years with this commitment in the organization, 8 years and 10 months as an ally and the mother all of the sets for all of the sets family. We go back with you now, Kenny. Thankful words are never going to be enough for all of us that made all of this possible. We've talked about the beginning, the challenges, and now the question is, where are we heading? What do we want to see from CES in the upcoming years? I would like to introduce to you all Sheila Davis. Dr. Sheila Davis is the General Director of Partners in Health. Previously, Dr. Davis was Chief of Clinical Operations and Chief of Clinics in Partners in Health, where she supervised the efforts of infirmary and the supply chain, medical informatic and lab infrastructure, and the activities of improvement of
Anteriormente
life.
ocupó el cargo
Previously,
de
she
jefa
had
de
the
respuesta al
supervisor
ébola,
of response
al dirigir los esfuerzos
by
de
directing
respuesta
the
de
efforts of
emergencia durante
responsibility
la
of
epidemia de
Partners in
África
Health during the
Occidental y
African
Oriental. Ha sido
epidemics
una
of
líder de la
infection. He has been the
enfermería en
leader of
campos
infirmary in the
VIH
field of
desde mediados
HIV
de la década de 1980.
from
Sirvió
1980,
en la
and
Junta
she
Nacional de
served
la
in the
Asociación de
National Board of the
Enfermeras
Association
para el
of
cuidado de
Nurses
AIDS.
for the care of
Entró en el
AIDS.
ámbito de la salud mundial en
She
1999,
started with
respondiendo a la
World
epidemia
Health in
mundial de
1999, responding
VIH
to
y
the World
trabajando en
Epidemic
varios
of
países.
HIV and working in
Fue
different countries. She
cofundadora
was
de
the
una pequeña
coordinator
ONG,
of the small
trabajó en
NGO
Sudáfrica
that
y
worked in South Africa and Boston since
en
2004 and
2010 proyectos de
2010
salud,
projects of health,
incluida una clínica de
including
enfermería
an
en una
infirmary
aldea
clinic
rural.
in a
La
rural
doctora Davis es una
village.
frecuente
Dr. David
oradora
is an eloquent speaker
sobre temas clínicos y
on
de salud
clinical
como el
topics
VIH-Sida,
worldwide, speaking like
epidemia de ébola,
HIV, the Ebola
terapia de salud
epidemic,
pública y el
leadership in
papel de
public
la
health, and
enfermería en los
also in
derechos humanos.
infirmary and human rights.
Thank you so much. Happy anniversary,
Muchas gracias.
Compañeros and Salud. It's been an exciting 10 years.
Ya son
I'm really excited to talk to all of you today about the One PIH family,
sobre la manera en la que
of
trabajamos.
which Compañeros and Salud is a huge piece of and has been one of the leaders for over a decade. The One PIH family is made up of 11 different entities around the world, and our goal is having one aligned mission, and we're a social justice global health organization. So our goal is to ease suffering by providing a comprehensive model of care. And this care includes food, water, essential things that people need to live a dignified and good quality life. Our founder, Paul Farmer, always talks about how one life is not worth less than another, and that's a huge piece of what we believe and what we strive for globally. Our model is one of accompaniment, and accompaniment meaning that we walk beside our patients in our communities, as well as with our partners in ministries of health around the world. Our goal is to show that people can have qualified clinicians, nurses, doctors, and community health workers who are able to be trained in the countries in which they work and be able to provide quality care to patients in their homes and in facilities. We also strive to change the dynamic and work on policy and do research to be able to show and produce evidence to show that things can be different for people. And that's part of what we do in joining in collaboration with people around the world and as part of larger global health equity movements. Compañeros and Salud has been one of our amazing partners and part of our network, and we're especially so happy that the nursing program and the leadership that's being shown to launch that has started and will help us around the world in other places. When we look at what has been happening or what has happened in the past 10 years, it's so impressive and also has shown us that we can work in many different places, and certainly our model is very effective. And what we're learning in Mexico is being now used in the United States as we work on COVID-19 and in our other countries around the world. I'm so pleased to be here today, and again, happy anniversary, and certainly congratulations, and we look forward to learning from you for the next decades to come. Thank you.
Y que tengan mejores éxitos en los siguientes 10 años. It's been a real honor to have a leader woman eh, for all of us that work in PIH, and not just to receive this experience in Mexico, but in Peru, and Haiti, and Malawi. We really appreciate the help that you provided us and the time that you've provided us today, and for the congratulations. Thank you very much for being here. Now I need some help sharing the screen. We have a question. What is ahead in the next years when time flies by and we're sharing so many emotions and this much happiness? We are able to look at this. So really briefly, we would like to share with you what's awaiting for us for Partners in Health in the upcoming years. What are we focusing on? An important part are always and will always be community workers and all of the work that they've made in collaboration with Partners in Health. So one of the efforts, or the most important efforts that we are looking at, is being able to provide formal hiring to our community workers and being able to keep growing as a family so they can have this formal hiring as health workers with all of the benefits that this should provide in our sector, in the health sector, in the regular formal work in the labor market. Like you want me mention, we started with a model where caregivers were specialized in one area. They were focused into providing and joining or providing services to pregnant women or hypertension type of patients. We're trying to look after a home model where caregivers, just as Remy was showing us, and I'll invite you to look at the recording when it's done. We have mapped out as a community, so caregivers have designed certain homes within their own community, so they make these house visits. This is a model based in the, I believe it is born in Cuba, but this model it's been developed in different countries. The intention is that the caregiver is in charge of the health of the community after paying the domicile visits and doing the preventive checkups. Timely diagnose, referring to clinic when something's not normal, and providing follow-up to patients with chronic diseases such as diabetes, hypertension. So achieving all of that through house visits that constantly have been paid to the community. Also, the health caregivers, we look to expand this knowledge across communities. Fatima already told us about the achievements the caregivers have obtained in the publishings and the importance of having mental health in the community. We also look to keep on expanding in the implementation of humanized delivery. So right now we are in Angel Albino Corso with a unit, and we look to get to communities that are even further, to be able to have a lot more access to a respectful delivery, humanized treatment under the regulation guided by obstetricians and with autonomy of women that's in front of them. We also look to keep on spending our surgery program. We have started like about 3 years ago with some surgeries. During the pandemic, we had to suspend them a little bit due to the whole situation. But next week, we'll retake and restart with another surgical campaign. And the challenges and the successes have been also a lot alongside community basic hospital. And the objective is to be able to provide surgery OBGYN, general surgeries that are available to fight with all the surgical delay that we have in our region. Another important program is the nursing program. We've worked a lot with intern doctors and obstetricians. And currently, we work to expand on this program through a interdisciplinary curriculum within the diploma that we provide to our interns. And that's togetherness of the three areas in health would be receiving the same type of diploma, and will grow as a group academically with a huge focus in social medicine, and to start putting together nurses. We already have nurses in communities, and to keep on strengthening it. So little by little, we can strengthen a multidisciplinary team in health that's put together in the clinics, not just by the doctor, by the nursing team, the doctors, auxiliaries of health, which are community workers, and that we're mentioning in our presentation of this morning, and our main presentation that we had, how important it was. And sometimes leadership is on the doctor's side, but sometimes the doctor is an intern, and the one that's many years there is the nurse. Oh, and so they are the ones that have all the knowledge of the community. So really, to look for this work, which is horizontal, of the interdisciplinary component or multidisciplinary component that might withhold the community workers, auxiliary of health, intern, and basically to provide wholesome attention to users of clinics, and to really have proper follow-up and better results in health. The, in the program that we're creating, we are finishing the creation of a curriculum, and we're looking for the infirmary program to overcome or to cover many years and strengthen the clinical knowledge that this autonomy has in consultations, because we know by law nurses can already prescribe, and well, this is a benefit, and they need to be benefited off of this community work, and also strengthen in activities such as resilience, conflict resolution, leadership, so they can start guiding us through the knowledge that they have of communities, and as a long-term type of work. We look for uh, expansion throughout the years, and really to be able to get to have these multidisciplinary teams in health, which is what we've trying to reinforce quite a lot during this Congress, the importance of the community worker, the importance of the psychologist, of the technician, of the laboratorist, the infirmary staff, and how important doctor is by working together and in a horizontal manner and as a teamwork. And under these following steps that we continue seeing growth in organization these upcoming years, I would like to invite Dr. Gustavo Nigenda, our research director, to share where are we heading in this branch. Gustavo, if you can please turn on your camera and mic. Good, we're good. Thank you very much, Val. I have to talk about what I consider maybe the future of the actions that we need to develop in the field of research. First off, I would like to tell you that I think everyone knows it. This is an organization that is dedicated completely to research, but more lean to service provision, innovation of attention models. So, however, in the says just as the sales showed it a while ago, we have a lot of investigation going on, and we have products of all this work. So I think that we have some matters and that we can discuss in the near future. I would like to be exhaustive, but I think that they could be most important elements to tackle. The first one would have to do with establishing a link with other organizations, especially universities, research institutions, that can allow us to share with experienced researchers their methodology, their methods of work, so we can strengthen this. Second of all, We have colleagues in the organization that are dedicated to doing research a different way, which indicates that all of them overall can be benefited a lot with training from theoretical models, from methodological models, and of research overall, to be able to incorporate all of this knowledge, not just in when providing services, but when establishing and wanting to make some research. A third of it, I think that's important given that CES can be considered as an innovation laboratory, managemental, if you like, of the first level of attention. And I believe that the demonstrative studies are really important to make. CES already has a small story, but it's important already and productive of demonstrative studies. And I believe that it's important to generate more of this type of studies because these are research and studies that generate evidence, scientific evidence that would allow us to establish how these innovations really could be implemented and can generate important products. So I believe that this type of design of research, we need to develop them even more in the DSs. I'll just try to talk a little bit about what Valeria said a while ago about the model of development of attention through nurses that's been developed. You already know the model, and we started it, and we started to make an assessment on how this would work in the first stages. And we hope that as this advancing, we can keep this type of evaluative process because finally the evaluative process, as long as they are in terms of identifying what type of products they or effects they generate, even better. So I think that this is important. Also, and even though we don't make demonstration studies, I believe that making studies or observational type on the observation of the SES model in the different areas, I think it's also something that we need to continue doing, and that's why I think that we need to combine all of the demonstrative part with the observational part, with the combination of uses of methodologies, of qualitative and quantitative measures, and even of the mix in a way that the studies that we can make are strengthened in methodological mean. Two more points, and I would say that we need to increase our capacity of looking for financing. Many of the financing that SES receives basically to you know, improve service provision, but having the need of doing these studies, I think that we need to increase our capacity of looking for resources that are fundamentally important to be able to do any type of study that we want or research that we want. Finally, I think that increasing productivity in diversity terms more than anything in through means where we publish, for example, works or results of research of a high academic level and of different type of publications that might also be of better access for public audiences. I think that that's important. I believe that if we can aim towards the development of research projects, productivity in consequence will increase. So I think that these are the points that I would point out as important for the future in strengthening the capacity of research that the SES has. Thank you. Thank you very much, Dr. Gustavo. We're really thrilled for the upcoming years, and there's a lot of path to cover, ground to cover. While we're still in a celebrative spirit, and to celebrate, we'll do a dynamic, and then we can go ahead and grab our drink so we can all have a toast together. I'll leave you with Liberty Whitman, Chief of Training and part of the salesman family, which is with us from Peru. Hi, everyone. Thank you very much, Kenny, for this dynamic, and I've shared in the comments some links so everyone could participate. We're doing a photo voice dynamic where everyone will have opportunity of sharing some photos and phrase with us. We have Palette, and this is a tool called Palette. It's dedicated to social justice and global health. And we invite you to share a picture of how social justice looks like in your context. So we have some examples here. In the lower part of your screen, you have a plus button so you can add pictures. So to add a picture, what you can do is load it from your computer or cell phone. You can take a picture in the moment, or you can link a photo. As an example, we'll load one. We have a picture here that represents global health or social justice, I'm sorry, of Chiapas, Mexico. We can write something, maybe a comment about the picture. We hope that you can also share your contact. If you have a website, for example, in particular, and let us know if we have our permission, of your permission to share this picture in our social network and other dates to promote the recordings of the event of social justice. So I'll ask you for permission. If you don't tell us that if you tell us that you don't, we have permission, we're not going to share it. If you're connected with a cell phone, it's the same dynamic of looking for the plus button and to look for that picture. Looks the same. So this is a palette of social justice. We have one for partners in health, and pretty much almost everyone that's here has visited us in Chiapas, and we hope that you have this picture for you to remember it by. And do you have one? Click on select photo here, and you write something about it. For example, put it here. For example, Halloween at Ceres. Your contact, and if we have permission to share this picture or not. No, I see that you're already uploading pictures. Nice. So I'll leave you a couple of minutes. You can upload your pictures. We have the QR code here, so you can connect your cell phone if you like. And I have sales helping me with the chat box. I shared it once, but it's always better to share it at different times. I put some music for a couple of minutes while you upload your pictures. Now we'll see which pictures are up. We have Jesse from Social Justice and we're working together. Excellent. Thank you very much for that. And we have a picture from a reform colleague. Nice, really nice. How we're doing here the memoirs of partners in health. Really nice memory. From Ineo, Paul, Erica, Fatima, Bruno, from communities. This is a real nice phrase. Huge privilege and great responsibility to be a part of this working team. Thank you to everyone for your continuous delivery and pouring yourself into the work. And thank you to all those in Chiapas. Thank you very much. Really nice. We have a picture of Sabrina in the wedding. I don't know who it is, but I feel the cakes throwing. Being a part of this wonderful congress. Wow, it's a nice memory that we are making today. It's been really informative for many students of medicine and many staff of Partners in Health. So thank you very much to our founders, Lindsay, Dan, Hugo, for generating these opportunities. Kenny's wedding, MC, was a real nice event. Halte York or Haltenango Park or Halte York as we know it. The backstage team of the Congress, which is doing a real nice job, team. Going back to social justice, we have more pictures here. We have some of the masters in nursing of renown participating in different activities, not in Partners in Health, but participating in activities of social justice in global health. Excellent. Gatherings of midwives in Chiapas, Mexico. Excellent. A picture of the Laguna del Cofre, which is a real nice community of Partners in Health, and another one of Monterrey. I think that this is Fatima, if I'm not mistaken, in Marca. That's from several years ago, I believe. And, and decent, dignified treatment to all of you if when arriving to this world is real nice. Thank you very much, everyone, for your participation. You can continue uploading pictures and letting us know if we have permission of sharing them with sharing your contact web page also if you like. These parallel pages will be open till next week, so all the week you can come back, look for more pictures, adding more, looking for contacts if it's aligned with one of your projects. Analyzing IQ data. This is a real memory for Partners in Health. For me, global health started by drinking tea with Daniel Palazuelos Fridays of 2012. Since I got here, they put in me a new vision and formed me, trained me as a medic throughout my career. I wouldn't be what I am today if it wasn't for you. This is real nice. We have a photo of Sirius, Melanie, Jaltenango, supporting the anti-stigma campaign for COVID vaccination is really important, not just in Chiapas, but around the world, actually. How are we doing with social justice, pictures in global health, house visits in Guatemala, really just like Chiapas. Vaccinating against COVID in the highlands. If you can get to health services, to ge- we need to get them the health services. It's really important. The brigade in Matasano.
Andrea repartiendo pollos.
Andrea just giving away chickens and partners in health, the training courses, the monthly course is something that I really miss. Everyone gets there, live together. We talk about really important topics in global health. Mayra, our hero, we all of people joining Capitan. At the beginning of the pandemic itself, we had Help America. Interns just taking a bath in the river, watching for the crocodiles. Dr. Matias Iberico walking to Jalpenango tacos. I miss Jalpenango tacos, honestly, and the quesadillas even more. My time is almost up with you, but I need to share. Thank you for your participation in such nice activity. We still see the pictures are being loaded, and even though we're far, I'll encourage you to keep on doing it. I'm in Peru in South America. I'm far away from Chiapas, but I feel like I'm right there with you. So a big warm hug to everyone, and I'll open the mic again to our MC, Kenya. Thank you very much, Liberty. It's real nice to see all of these pictures. It reminds us of everything that we went through, and we're still here. And now let me open the mic for Valeria and Jorge. Hi, good afternoon. How are you doing? I believe that we are in the toast of it all, right? Right, Vale? Yes. Rafa, it's about we'll give people a couple of minutes so they can get prepared. I'm Mexican, so I have my mezcal, so I can have a dose. Of course, you can have water, coffee, tea, Jamaica water, pozole, whatever you like the most. We'll give you a couple of minutes so we can have the official toast. And we need to take advantage of this time to keep on thinking while you go get your beverages. I wanted to. You can have your board prepared for a good mezcal. I have some red wine here. Jimmy has Jamaica water. Really good. What's your beverage? Well, I want to say something real quick, Val, if you allow me. Yeah, we have 2 more minutes to think. We know that we missed a lot of people. So Jime, Jorge. Yeah, so I'll get ahead of Jime. I think for me it's been really emotional to see this session of celebratory session, to hear the testimonies of all my colleagues has been really thrilling. I think that I've never felt really proud of this, or be a part of this organization and being a part of this team. I would like to mention especially everyone that makes possible this Partners in Health for Work every day. People that work in the field, that's in the land constantly, pouring their heart and soul for the organization and for the people of the highlands. It's really important for me to mention Janice's team, the chauffeurs, team that were out a lot, moving our team material. It's been a really important work for us. Those that work in the kitchen, in all of the kitchens, for the hospitals and Casa Verde, people in the cleaning crew, everyone that's a part of this organization, and that's completely important for the work that we do. I'm sorry, but my kid is crying. I think he fell, but I wanted to thank especially to all of the people that work constantly amid this pandemic. It's been a really hard year and a half in many senses. Everyone that uh, was able to put the part of the effort to respond amid this pandemic. All of the CESTI, one way or the other, has been involved in this. So we wanted to, I wanted you to know that we are really aware of the effort that you've had and how you've been pouring yourself into the work and for the people of the community as well. Thank you very much. And I don't know if everyone has their drink already. Jimena, let me give you the mic now. I spoke too much. Yeah, thank you very much, Jorge. As a director, I wanted to also thank all of the students that are here, especially to the Aves group. I don't know if we have people from the Aves group that currently are in the Aves group or that have been with us in the Aves group and that have made and that have joined us to do these active searches. And guys, you've been a really important part of search. You help us to build settings from the beginning. Many patients have got here due to the work, door by door work that you put. The universities are a huge seed bank of people and social movement as well. I would like to also thank especially to our beloved ITC team that during this whole pandemic have been fundamental to carry out this COVID response that we are deploying in the highlands. And that'll be all from me. Colleagues, on a personal level, you're my daily inspiration. I'm not going to get tired of telling you all. Thank you very much for being, and we're ready for the toast. Are we all ready? I hope so. I hope that you all have the beverage. And well, we'd like to remind all the students and universities, Karen was the one that inaugurated this care group, and this is something that we like a lot. Being able to see how you, people like Melanie, Karen, and many of our coordinators, for example, have had a huge life with Partners in Health. And this has been incredible being able to see how from the point that you're a student you can get involved in social justice and you can focus as an intern, as a volunteer, as a collaborator, and then from there to keep on growing in this organization. And if it's not within the organization, you can do one specialty, you can do different type of work, but always, once you are in Sethland, you'll always be Seth's family. And really, I think that we could all be here all day thanking everyone that made this possible. But more than that, we would like to put a video up, a celebratory video. And finally, after the video, we would like to make our toast. So if I'm allowed, Shy, to share my screen again. And thank you very much to the communications team, assessment, all of our programs. When I knew I had cancer, I felt sad. I sat down and cried. Until that point, we never heard of the word cancer even. Weren't even, we didn't even know how this was possible. We never had a symptom or anything that would tell us that she had it. And I was 90 years old. the best quality of medicine in Mexico. One every three people don't have access to health service, and in the most marginated places, marginal places, one every 12. So what we were able to achieve during these 10 years was to grow in impact and in different programs to be able to provide And just to finalize our great event, the beginning of our celebration, because we're still missing a lot of party. When the pandemic will allow it, we'll do it. A lot of comments, really nice comments. Thank you, everyone that's commenting right now. Thank you for your thoughts. Really well. Jorge, Jime, would you like to lead the path in this last? Yeah, I believe that given that once everyone has their drink, I think it's been a really exhaustive type of work during the last 10 years. These people has a lot of time in the organization and carried this organization in their backs. I'd like to thank all the people from logistics, supply chain, finances, people from human resources, for the team that's in City Mexico, to six ambassadors, to all the team that makes this work possible. I would like to thank you. Thank you for the effort. It's been 10 years of fighting for social justice. And this is like a new beginning, looks like, for of a new era. And I think that the team is really well strengthened here. And I believe that the goals, if it's true, they're really ambitious. The team spirit they work with is a real strong spirit, and it's a spirit that every day has the clarity of awakening and fight for social justice and for people that have a restricted access to health and quality health to obtain it from me. I'll bring to that. And for anyone that, in a way, it's a part of this huge family. Cheers, and please, Jimmy, you go too. And finally, I would like to thank all the population and everyone that received us, all of the communities that have received us, our patients that have allowed us to get to their homes, that have given us the trust of being able to help you out, of being your servers. We're still an option. We want to be the preferential option for all of you. And that's it. Thank you very much for your trust, and know that we are keep on moving forward for you. Thank you, and cheers. Cheers. This is not for us. This is not for us, but for the mission of the organization, for the work of the 10 sites, for the right to health and social justice. Thank you very much for uniting. Thank you very much for having this toast with us, and especially thank you for keep on working and struggling with us and fighting with us in this, because we can't stop. We can't be just comfortable until everyone has the same access to health, the same amount of quality. Okay, just for everyone. Cheers. Bye bye.